The Gauteng Health Department has refuted claims that its hospitals are in a poor state. This, of course, follows a viral video by veteran broadcaster Tom London, who was admitted to the Helen Joseph Hospital and who shared his experiences on social media. Have a listen to the complaint by Tom London, basically requesting for common decency.
Now, earlier on, I put a video up of the guy opposite me who was busy dying. I'm going to turn this camera around, right? He's dead. He died 20 minutes ago. He's lying there in that bed. He's actually gone. He's dead. But here's just a few minutes in the day in the life of the Helen Joseph Circus Hospital, where the doctors talk about their cars and their clothes and their bonuses while people lie dying in front of them.
We're joined now by Motaletale Modiba, who is the head of communications for the Gauteng Health Department. And as always, thank you so much for your time this morning.
Thank you, Bongani.
I suppose, firstly, a broad response. No doubt you would have seen the videos that have been circulating on social media. The allegations and really the complaints that Tom London laid out in those videos, including what you just heard. What's your response?
Look, it's obviously disheartening, Bongani, in terms of just the experience of care that would have been given out. And I think that's why we immediately indicated that we obviously have to sort of investigate because it's made serious allegations against the clinicians at the facility. And in terms of fairness, we also have to give them a right to reply and present their side of the story. But just listening from what Tom London is saying, it's disheartening, and I think we upfront need to, I think, apologize, because if you look at just at a basic level, insofar as key communication behaviors that create a positive interactions between ourselves as healthcare workers and patients. There's what we call the aided model, where you have to acknowledge a patient who's there, you introduce yourself, you explain the duration that they will be at the facility, you then explain the type of treatment that they would have to, you thank them for giving you an opportunity to actually interact with them. And just listening to the clip, it sounds like we have not done well in that particular area, because I think in as much as there's quite a number of issues that you would have raised, especially around infrastructure and perhaps that, I think at the heart of his cry is the issues around the patient experience of care. Because with infrastructure, there are some interventions we are doing work at the very facility, and which people can be able to see and so forth. And I suppose it will take a bit of time to cover almost every area. But you can't excuse the staff attitude and so forth. And I think it's the reason why we have introduced an intervention program of the I Serve with a Smile, because the feedback that we have received over a period of time has told us that we really need to work on that particular area. That while the other areas are also equally important, but this area can make a difference in terms of creating a conducive environment where a patient feels that, yes, there are these challenges, but I think I feel I'm receiving the type of attention I need to receive. Look, from the reports that we've received, Bongani, clinically speaking, the right processes were followed, the right level of care was given, but I think we failed dismally at when it comes to bedside manner, when it comes to the patient experience of care.
Look, I mean, his complaints weren't just about, the doctors weren't very nice to me. And whilst most people who depend on public facilities might understand that the infrastructure might be old, they might even understand that perhaps things aren't always working optimally, so from leaking pipes to broken equipment, when fundamental basic human rights are ignored and people are not treated with the appropriate decency, that's what is heartbreaking about the system. Because even as people want to understand the pressure that the clinicians might be under, when they themselves are the ones dishing out the bad treatment, what do we do?
Look, on our side, Bongani, we have already committed ourselves to a program, and we are currently intervening, not just at Helen Joseph, across the system, insofar as the program that I've mentioned is concerned. At Helen Joseph in particular, because obviously the program, it seems like the issue of attitude and so forth is more pronounced there as well. We're going to be rolling out a program there, fast-tracking the Serve with a Smile, doing a whole sort of long-term program of onboarding the healthcare workers again, doing a code of conduct, ethics training, communication skills, conflict management. So we're going to take them through an entire program as part of the redress process, because obviously it's not something that we can just deal with once off. It means that we need to go a long haul so that come a couple of months later, when you and I have a conversation, the situation and the experience of care can be different from what it currently is, because you can't. And for me personally, as I was listening, I think that is at the heart of the cry. To say, at least there must be that empathy. At least I must get a sense that those that are given an opportunity to take care of me, their heart is in the right place.
Here's the other thing that's difficult. Here's the other thing that's difficult. Not everyone is a Tom London. Not everyone can post videos that will receive the kind of attention his have. What's also difficult to swallow is that yours is a department that's allocated, 1.5 billion rand as far as healthcare infrastructure. And so when you see some of the visuals from that hospital, the ceilings that are caking, the leaking pipes, the broken equipment, the sense that there's a severe pressure on staff because of a lack of resources, and then, of course, coupled with the attitude you and I have just described, it's difficult to swallow this. How many Tom Londons, in other words, how many Tom Londons who don't have, the kind of public attention that he received, how many are going through the same experience and nobody knows?
Look, we have established what you call a quality assurance office across all facilities, and I'll be happy to share, I think, those details with yourselves to allow any of our patients, and this is part of what we do whenever we do the patient experience of care surveys, that if you're at a healthcare facility and you are not happy with the level of service that you are getting, don't keep quiet. Raise that particular concern. Of course, some people will choose a different platform to raise the concern, but we do have channels within where we're able to say, you can speak to the quality assurance manager. If it needs be, you are able to speak to the CEO of the facility so that your issue can receive immediate attention. A lot of people utilize that system, and there is intervention that is given when people voice their concern. But of course, we do acknowledge that people will use a platform that they are most comfortable with. And I think the issue is not even the platform that people are raising the concern on. The bottom line is that the feedback is critical. It allows us to also intervene, because as you are rightly saying, Mongani, at the end of the day, there is someone that probably is being paid overtime or committed overtime for the work that needs to happen in that particular facility. This kind of feedback allows us then to also hold them accountable as well, so that we're able to say, but this is what the patients are saying, and it's not matching what we have agreed on. And we really apologize in terms of the treatment not given to Tom London, but to any other patient who might have gone through a similar type of experience. And I'll be glad to leave the details with your producers so that perhaps through your platform you can also, I think, announce those to the public so that they are able to utilize those platforms. But we definitely do encourage patients voicing out their dissatisfaction, because that's the only way we're going to also be able to deal with some of these blind spot areas.
Motaletale Modiba, we're going to have to leave it there, Head of Communications for the Gauteng Department of Health. And whilst I appreciate what he is telling us about the formal channels, who remembers that patient from Tembisa Hospital who had to tweet then Minister Zweli Mkhize from his hospital bed begging for assistance? Didn't he die in the end?
Yeah.
Current events, developing stories,
tough questions,
your voice making a difference.
This is Breakfast with Bongani Bingwa.